And with no further ado, I will turn it over to our moderator for the session, Kathy Tix.
Well, hello, everybody, and thank you for coming and joining us this afternoon. I really appreciate the fact that you showed up and that you're interested in this topic. Tonight, we are going to be speaking about a platform that was personally created for some of our bleeding disorder community, our African American bleeding disorder community. And I am a social worker at the UH Case Medical Center in Cleveland, Ohio. And I just want to let you know that you'll be able to ask some questions near the end, and hopefully you'll enjoy the information. So I want to start with Deja Smith. Deja, can you introduce yourself?
Yes, Kathy, thank you. Hi, everyone. My name is Deja Smith. I currently live in Charlotte, North Carolina. I am a member of the NYLI, which is the National Youth Leadership Institute at NHF. I've been a part of the bleeding disorders community for a while now, as I have a sibling with hemophilia A. And I'm just happy to be here. I'm happy to see all of you. I'm happy that we were all able to meet in some form or fashion. And I hope that you enjoy the session.
Eric, can you introduce yourself next?
Sure, no problem. I am Eric Malone. I am also a member of the National Youth Leadership Institute. I have severe hemophilia A. I also have a younger brother with severe hemophilia A. And I'm currently a college student looking to go into physical therapy. I hope you all enjoy the session, and I'm glad I could be here.
Physical therapy, huh? Do you plan on working in our bleeding disorder community, Eric?
Possibly. We'll see what happens. We'll see. Hopefully.
I hope so. I hope so. Next, let's have Connie. Connie?
Hello, everyone. I'm really excited to be here this evening. My name is Connie Montgomery. As I think we stated a little bit earlier, I'm an international speaker, author, and program developer. I'm a wife, a mom, a caregiver, a retired occupational therapist, and a current patient and family advisor at the Medical University of South Carolina. Most importantly, I'm a patient with a rare bleeding disorder, factor VII deficiency, to be specific. I've traveled all over the country speaking to various chapters, and I absolutely enjoy that because I get to meet and network with so many families. Very happy to be here tonight and really excited this platform exists. So we'll be seeing you.
Wow, thank you, Connie. You have a lot going on, lady. Welcome, and I appreciate being on here with all of you great leaders. What about you, Christopher? You're still on mute.
Hi, my name is Christopher Maddox, and I'm a hemophilia B patient with an inhibitor. I have a younger brother who has the same thing as I do, and I'm hoping to share my experience, my life of learning about being in this community and knowing that things can become very good and helping out our Black community and making everything work perfectly.
Thank you, Christopher. And last but not least, Mosey Williams. Hi.
Hi, thanks, Kathy. Hi, my name is Mosey Williams, also a hemophiliac, severe hemophilia A with an inhibitor. I have two other brothers with hemophilia as well. I enjoy being part of the community, just feel connecting with other brothers and sisters with bleeding disorders, and have an opportunity to do that, and particularly to look for opportunities to look at some of the things that the Black community isn't necessarily getting in healthcare, and just kind of talk about those things and come up with action steps to work through that. And I also currently work community social worker.
Okay. Okay. Fellow social worker. Listen, you mentioned that all of you are here just to kind of address some of the things that we feel that the Black community is not receiving from some of our caregivers. Christopher, can you continue with that? The purpose of the platform, the Health Unlock platform?
Yes, thank you, Kathy. That platform we're working towards, and I say this carefully, the platform we're going to be talking about is called Health Unlock, provided by the National Hemophilia Foundation, which is to help us as African Americans to try to better ourselves, to educate ourselves, to teach us that we can help each other in talking about things that are important to us, to make sure we can talk to us, share the different aspects of what's wrong with our hemophilia and other things that the doctors don't always want to tell everybody else that. You know, the doctors have sometimes have tendency to tell things that they don't like to talk about the patient about, or things that are not quite correctly or whatever. So this platform that we'll be talking about is called Health Unlock. And this platform is to help us with our communicating through things that we really want to hear from our own other community members of ourselves, because we don't have a voice as we should be having a voice. So this platform here is the way to help us. So we have it to where we can go, if you go onto the website of the nhf.nhf /health unlock, you can go right to that, and you will see to where you can open it up. Once you see the platform, the picture of the opening of that, you will see the beginnings of how things will work out. You would go into the information to log in to create your account, to help yourself become familiarized with what's going on with that platform. Then you would give your opportunity of talking with people like you're doing, like you're seeing right here, talking with people, trying to communicate and getting things that you understand about the problems that you're dealing with being African American in the community that we are as Black people.
Okay, thank you, Christopher. So bottom line is that the platform was created for African Americans, and I do know the history in evaluation forms across time over the past 10 years. There has always been, we need a forum to where we can talk comfortably about
Right.
some of the things that we face.
Right.
So this was created, but what you're saying, this was created exactly for that purpose.
Correct.
I know that Connie was around way back when as well. Connie, did you have anything to add about this platform?
Yes, NHF a couple of years ago had an expert come in with a PhD and do a survey to various chapters. I think we about 53 chapters at the time, and asked the Black members in those chapters what were some of the things that was missing, what was something they wanted to see. And the input that was provided to that expert that did that survey, she found that we definitely needed a platform where Black voices could be heard, so we could put some actionable steps in place to do some of the things that need to be done within the National Hemophilia Foundation Bleeding Disorders community. Then later on, we were blessed to hire the Vice President of Diversity, Inclusion, and Equity at NHF, Carrie Norris. And Dr. Carrie Norris is really opening the door and opening our eyes to all the things that we should be starting to consider so far as African American and other marginalized communities. And so this platform here for Black people is going to be just the beginning of us. And we want to hear other people's input. So this is the beginning phase, and we are the leaders in the committee right now, but we want to hear from others and get other people involved. So if you got ideas and you're interested in joining, please come.
Well, you hit it right on the head, Connie, and I'm just going to add just a little bit. You know, there might be some people on tonight that don't believe in inequity between patient populations, between patient demographics. We've had a time over the past few years, especially during COVID and some unrest in our political system, to where some things had been revealed. And not only are they revealed out in the general public, but some of our African American patients and families say that it's revealed right in the clinic room, right? So Mosey, why don't you start right there for us? What are some of the greatest areas of concern when it comes to health equity for some of our African American members of this community?
I think that some of it starts before we even get to the clinic room in terms of access. My own experience has been such, and this would be outside of the HTCs that I've experienced, but even getting to the hospital, riding the shuttles and being profiled and things like that. So we have those experiences. And then there's a general experience of getting prescriptions filled outside the HTC and, you know, dealing with that and people wondering, do you need that particular medication for pain fulfilled? And so dealing with those kind of challenges, which are outside the HTC. And so with that, I think that one thing that I've tried to do is trying to bring those things to the attention of the HTC so that they can work through that, because my experiences have been good within the hemophilia treatment center. And so when I have these experiences, bringing them to them so they can possibly work with us as patients to kind of circumvent those other biases that take place outside of there, and also be aware if they're happening within, across the country as well. So they can possibly fulfill a prescription in a way that, so I wouldn't have to go to a certain facility that's not going to honor it or whatever. So I think that that's one thing that can be done to kind of work through some of the discrepancies and discrimination in treatment that we see.
Okay, Mosey, you made a couple of great points. Eric, I'm going to come to you next, but I want to go back to where Mosey said he used the term biases. He used the term prescription meds when it comes down, especially to pain medications. There might be some stereotypes out there about your drug seeking, and just based on your color and based on how you present, somebody is assuming that it's not really for your pain. We've all seen that, right? So instead of pain, we might have some stereotypes about addiction when it comes to some folks in our community. So Eric, as someone, so Mosey is a social worker. He's a social worker out there. So there are some things that he sees that a lot of us don't see. What about you, Eric? Have you experienced any of that being a young Black man?
Yeah, I'd say I definitely have, just in different, everybody has like different walks of life, different experiences, but at the same time, we all kind of come back in one like full circle. So I think one instance that I can recall is that when I was younger, my mom was often, since she was a younger mother, was kind of treated as if she really didn't know anything, kind of like belittled by like the doctors. And as a result, we didn't receive the best care that we could have, the best treatment that we could have. And that's just one off the top of my head. But I definitely think that Mosey hit the nail on the head with a lot of points.
Okay.
Yeah.
So what we're saying is that this platform is a safe place for people to be able to come and discuss situations like that without being judged, right? Sometimes when you walk into the clinic room, you feel like you're being judged based on just, there are a lot of thoughts about us as African-American folk, right? So how can we build more trust? What can we do to build trust in the clinic room? Let's start there, since that's the most important spot for all of us. Where do we start?
That's a tough question. I think one place we can start is representation. Just having more Black men and Black women in, the healthcare field and in health professions. I think, you can have, a Black doctor, a white doctor, Arab, Mexican, Chinese, whatever doctor, and they all have the same level of knowledge. But the difference is that doctor who's Black knows the Black experience and knows, to an extent what you go through, and so it's a level of increased comfort and increased security, because the relationship between Black people and health professionals is kind of like rocky and weird in our community. I mean, you see a lot of people are skeptical of, the COVID vaccine. You see a lot of people are, skeptical of certain treatments or whatever. And usually it has a justifiable reason behind it sometimes, in the Black community, a lot of people were bringing up, how the Tuskegee Airmen, the situation with them. They were bringing up, I think Connie had mentioned how Black women were basically treated as lab rats by the father of modern gynecology to establish the system we have around that today. And then we got, or like Mosey said, just general personal experiences, even in the bleeding disorder community, bad blood being given to Black men and Black women. So the reasons are justifiable, but at the same time, I worry about the long-term effect of this skepticism. We can't be skeptical and so cautious forever. Otherwise, we may not get treatment that we actually need, you know? So
Now, I want to make sure that everybody knows that we know that there might be some points made on this platform tonight that are personal, right, to some of the leaders that are on here. So we're not saying that every single provider out there is doing something that's not in our best interest. And we're also not saying that everybody has the same experiences, correct? But what Eric just said, I do believe it goes a long way back, maybe over 100 years, as far as the mistrust with some things, with some members of our community. And maybe at some point in time, all of us have felt it. I know that I have, as a social worker in the community, as a patient. I've gotten treated differently than other folk, right? Deja, as a young African American woman, can you tell us a little bit maybe about how you believe we can build trust from your vantage point? Because your vantage point is a little different from mine, right? My next birthday is going into my 60th chapter. But you, young lady, you're not. You're up and coming, new and improved, vibrant thinking, forward thinking. Not saying that I'm not, but at the same time, your vantage point is different from mine. So what do you think about some of the ways we might be able to build trust?
Yes, Kathy. First, I want to say thanks for all those beautiful words you just gave me. I would say education. Education is the most important. And I think it's so hard for us to pinpoint a cause, pinpoint an effect, and pinpoint a solution within our community because we have just been so disproportionately disadvantaged. We have so many disadvantages in so many different areas and aspects of our lives. So it makes it extremely difficult. But I believe mindedness, openness to education, even if you may disagree, agree to disagree. Maybe just taking the time to just listen, even if you feel like you've already kind of, chosen one side or the other. If someone's presenting you with a reason as to maybe why you should get the COVID vaccine or why you should maybe seek out a different treatment center or a different doctor or a different nurse, just having the ability to just give somebody that listening ear and maybe see why their reasons could be valid over the experience that you've already had. I would just say from my perspective, even though I'm not an individual with a bleeding disorder, me and my brother are about 4 years apart. And growing up, I know that we have had, I guess, maybe the lucky side of the coin. It's been that maybe around like the first couple of times where he's had maybe a major bleed and had to have been admitted to the hospital and things like that. My parents definitely had to experience doctors that maybe did not even understand what hemophilia was, or nurses that couldn't find a vein and things like that. And I never knew that pain because like I said, I'm not affected. However, they educated themselves. And then moving forward, when something was presented like a certain treatment or a certain, method of, course of treatment or whether he should be hospitalized or not and things like that, my parents were able to stand up and advocate. And I think that's a lot of it too. Being able to advocate for yourself, being able to advocate for your children, just through education, because I feel like we hear this all the time in our community, that knowledge is power. And that is very true. So when you have that knowledge, no one can take it away from you. And when you step up and you say and you advocate and you speak from the truth and the knowledge that you have, no one can deny that, whether they're a doctor of 30 plus years of experience. So that's what I would say.
Wow. 3 things, okay? You mentioned COVID. Let's start there. And that's a voluntary thing right now, right? We know that one has been FDA approved as we speak. And why aren't more of us getting the vaccine? Connie, what do you think? And I say us as African Americans, we know the data out there. The data says that we are lagging behind in some of the African-American communities with the COVID vaccines. So give us a short blurb about why you think that is.
We're looking at and listening to all the information that's been shared so far regarding representation in the healthcare field, not seeing a lot of African Americans or Black and brown people that look like yourself. We're also talking about not being heard or being dismissed, or the symptomology not being respected once the patient shares, this is what I've got, being a Black or brown person. Plus, there's been a little bit of social determinants discussed here. The barriers were discussed here. Possibly, there's no transportation or a lower socioeconomic status. Just so many different variables out there that play into getting good health care. But namely regarding the reluctance for the vaccine so far as African Americans, I really feel like the historical perspective, of course, plays a big part in it. Because in the nation of the United States, our first medical checkup was right down the road from where I live in Charleston, South Carolina, on the slavery auction block. That was the Black people's first experience to a medical checkup. So this has been imprinted deeply in the Black community because our ancestors and our grandparents and great-grandparents have told us of these unkind experiences. Then you have the younger generations going to the doctor's facilities, and they're not being heard or not being listened to, or like Mosey just shared with us earlier, being thought to be drug seeking,
Right.
and not truly saying, I need this medication because I'm deeply in pain. So all of these things have added to the situation in which we find ourselves with a lot of distrust and mistrust in the African-American Black community regarding this vaccine. So we're gonna have to do the things that these young folks have spoke about. We're gonna have to build a bridge with education, advocacy, and continual representation.
Now, I am going to play the opposite side here, right? So all of the experimentation and everything that you're talking about in the slave block on the first exam, that was so long ago. So what does that have to do with now? Now, I know that answer, but there might be somebody watching that might not know that answer and might not know how exponentially things have compounded over the last hundreds of years, right? Now I put that plural, hundreds of years. So who needs the education? And who needs to be the advocate, right? We've got about 10 more minutes. I want to close out with that portion. Who should be educated about the African-American experience and why this platform is needed? What if I'm not a brown person, not a Black person that says, why do they get a platform? So what do you think? Who needs the education? Chris?
We all need the education, no matter what we are, because we're all dealing with this. No matter what happens, we're all dealing with being a bleeding person with a bleeding disorder, because we're all in this as a family. This is a whole community of all of us trying to help every one of us to be better, to help make our health better, to make us survive and strive to be who we want to be, not just be another number, be a number, be a statistic, be anything else that we are. We all want something, and that is one purpose of all, and that's to be known that we have a bleeding disorder. That is why we are doing this now, so that the platform can be helpful to others to make their voices be heard, so that everybody can be doing the same thing we are doing. It starts with us first, then it'll gradually trickle down to everybody else. That is what I believe, and that's how I know it is. Thank you very much.
Oh, you are so welcome very much. And you mentioned being heard. Unless you are a person that's ever been dismissed as if you didn't count, it's difficult to understand that dismissal, right? Unless you are a person that's been ignored because of the demographic and who you are, whether it be woman or a Black man or Asian or anything, unless you've been in that situation, it's difficult for you to understand being dismissed. And once you're dismissed, everything else follows after that. I'm not going to really hear you when you tell me what your symptomology is. I'm not going to really pay attention to you when you tell me how you believe your body is functioning and where you need help. And it's a ripple effect. And that's really what the inequity is about, that rippling effect. So, and it's not just us. We just happen to be lucky enough for NHF to have heard the fact that we need a platform. Sometimes we cannot speak freely, and being able to speak freely, and Eric, I want you to discuss this as well, being able to speak freely and come up with some resolutions from people that look like you, for people that look like you. How important is that?
Oh, it's extremely important. It's extremely important to have, to gather so many thinkers and to really build, we can build, I guess, what's the word I'm looking for? I don't want to say bridge, but like build the.
I know there's camaraderie that's built. There's an alikeness camaraderie that's built when people sign onto that platform. Exactly, and kind of be our own solution. We can be our own fix for the community, and we can work and have a goal to work toward, It's like problem solving amongst people that have had a like problem, and helping people to, this is what you need to do, and this is what you need to say, and this is how you need to approach your medical team. And these are some ideas about how you can stop being dismissed and how you can advocate for yourself. And that's pretty much why this platform was created. Mm-hmm. So and it's a great feeling. It's a great feeling to be a part, to see the solution, to be a part of the solution, and to see all the problems that you've been working towards fixing finally coming together with this huge community. Right. And as we close, I think maybe we have 5 or so minutes. I'm not quite sure, but we want to leave space for folks to be able to ask some questions of us. But there's a lot of work that needs to be done. And it's not just with us, for us, by us. There's a lot of work that needs to be done from others that are in leadership position, that are in charge of the treatment centers, that are making the protocols, that are training the doctors and the nurses and things like that. Do you think that will help? Do you think it would help if the training started from the top, the medical directors, and worked its way down? Anybody can answer that. Deja, what about you?
I was hoping you'd call on me.
I know, you looked like you were.
No, I absolutely agree. They don't call it the trickle down method for no reason. I think it's important to go for the beast, go for the lion. We're here to stay. We've always been here, and we need people to stand up for us and to reason with us and to listen to us. And sometimes for a monumental change to occur, you need monumental people. And we are monumental people all in our own right, but sometimes you need that spearhead. So yes, I absolutely agree. This is like a call to action, calling everyone at the top to trickle down method.
I like that term, monumental, starting at the top. And NHF set a very great example that can be spread across the country. Starting this in the HTCs is a great way to disseminate training and things like that. And I do believe the education department is working on that. So before we close out, we've got about 5 more minutes. Does anybody, Mosey, do you have any closing thoughts about the platform and what you hope for folks who sign in?
I can say that I appreciate the platform. It means that the governing body, NHF, is listening. And so when we talk about having a voice, and they're actually listening, and they're waiting to hear our comments and our recommendations and our experiences. Also, from what Christopher said, we all need education, and that goes for patients and also for whether it's incoming and current medical providers, whether it's continuing education around anti-racist understanding and education around biases and everything like that, because unfortunately, or even some Black people and Black providers don't have the experiences and dismiss the impact of racism in our community and other communities as well. So people need to be educated about the facts around it and see the healthcare disparities like the it's in the numbers. And so Deja said education, Christopher said let's educate everybody. So I can
And another point, Mosey, there are Black folk that also have some discriminatory behavior towards other Black folk.
Mhm.
So it's not just one demographic. It's everybody needing to take a look at how they view ourselves. I have found myself being biased as well against people my own color. I can say that out loud. This is a safe platform, right? And I do believe all of us have had some thoughts about some folks that they didn't quite understand. It's about the understanding. It's about being clear about people's motives. And, you know, so we just can't put a blanket over one set of people with one set of thoughts. It's a lot of us that come from a lot of different areas of this world that have their thoughts about people of brown skin. And I'd say all the time, I've been wrapped in this brown skin a long time, and I've experienced a lot of things. Moving into a neighborhood where we were the first family, we were bricked, our houses were bricked and egged and told to get out. And I was afraid to go to the doctor because nobody there looked like me. But now we have doctors and people that look like us, and they also get discriminated against, but also they are there to kind of help change some things as well. Connie, any closing thoughts from you?
Yes, I'd like to say I'm just honored to be serving with this group of people that's already doing some work, not just on the Health Unlocked platform, but even the work that you guys are doing within the bleeding disorders community. Mosey, you were a BDC co-chair at one time and facilitator for NHF's and HFA's educational mental health workshops. Kathy, BDC co-chair and always facilitating some type of session. Chris, you're getting involved in teaching us about this platform. I appreciate that. Deja, you and Eric leading and heading up this leadership team. You know, this is movement and this is progress. So that's what I want to say. And I'm happy about seeing this progress. And I want to have others, if you were interested, please come join us. We can do it together.
That's right. And we're looking for some new leaders as well. So we're going to have a question and answer session in a few seconds, but think about signing on to the platform. Think about becoming new leadership on this platform. And if you feel like you have anything to add, if you feel that you have a direction that you want to go that we're not going, please, please, please don't hesitate to let us know. Okay. We are going to get out of the way so that you can come on in and ask some questions, and we can be ready for you. All righty, thanks for listening to us. Now we're ready to take you on and listen to you.
All right. We are ready for our live Q&A. We have some panelists here, and I haven't seen any questions come in yet. I did see one note, but it wasn't a question. So Kathy, until questions come in, I will just go ahead and turn the rest of the time over to you and the rest of the leadership committee. Thank you.
Can we read that comment? Is that the one from
Absolutely.
Yes, about the hysterectomies? Is that the one you're talking about? Let's read that one.
Okay, I'll read it. Or you
okay.
can. What would you like?
I'll let you read it. I've just done enough talking. Let me hear your voice.
Sounds good. All right. Many women who I know had a heavy men's cycle, and many PCP recommended a hysterectomy. It causes me to have questions and to advocate and do my own research after going to any PCP or a personal care provider.
Okay. Now, I don't know, it was a great comment, first of all, but I do know in connection with this platform and what we're discussing, if that person is maybe saying, maybe there's been some, over diagnoses of that need of a hysterectomy. I know, telling my mom's business here, but I remember my mother having a hysterectomy maybe about 45, 50 years. How old am I? I was in elementary school, so it was about 50 years ago. And when I look back, the first thing I say is, I wonder if there's a bleeding disorder in this family. I wonder if she really needed to get a hysterectomy. Or I wonder if that was just a really convenient way to treat her as an African-American woman. I don't know. I don't know enough data about hysterectomies, but this person said that she has become an advocate and she does her own research. So that means regardless of the color, that there might be some thoughts there about maybe some women, and that is another minority group. We're still trying to get paid, right? The same as others in this country. But she might be saying that there may have been some overrepresentation of surgeries that could have turned out a different way. Does anybody else want to comment on that or have any experience with that on the panel? Because I can talk now. I can take the next 15 minutes. Okay. Any more questions there?
Yeah, we had one more question come in. What advice would you give to community members who might be hesitant to share their info and get on the Health Unlocked platform?
Oh. Anybody want to take that on?
Yes, Kathy. I would say that, don't be afraid, we don't bite, right? Health Unlocked actually is a closed discussion forum, so it is truly a safe space. Even though it is operated by NHF or through NHF, it actually is closed when you sign up. There will be a couple of little things that let you know and pop-ups to tell you that, your information is private and it stays within that group. Nothing is exported out of that data-wise or anything like that. So feel free to come join us.
Anyone else? Because I have a comment on that.
I'm actually currently doing Health Unlocked right now as we speak. So that makes it even more exciting because I'm one of the people that actually were talking about this. And I think that if I'm talking about it, I'm putting my information in, you should try to join and do the same thing with all of us. So that is the best way of doing it. We're all communicating. Hey, Eric, are you doing it next? Or what are you going to be doing? Mosey, Connie, are you guys doing it at all? Let me see. Let me know. Okay? Bye.
Yeah. That's a great point. And I'm going to take that person's question just a little bit further because I've experienced the same thing. When I first got on Health Unlocked, I put this nice 2-paragraph dialogue out there. I mean, I just put myself out there because if we say it's going to be a safe space, I think that that person might be asking, is it really a safe space, right? Or will you walk away with people thinking a certain thing about you or feeling a little bit uncomfortable because they now know how you feel about color, how you feel about the way other people treat you, how you feel about going into the clinic room and maybe saying some things that might make you a little bit more uncomfortable. I can understand that. It's been so long where a lot of people have not been able to comment and say their true feelings, that it might be the first time and it might not be a really good comfort zone. So the only thing that I can say, and maybe I can get out of the way for another panelist to speak, but just come and see. Just come and see what we're putting out there. Just come and see the types of dialogue that we're having. And you don't have to share everything all at once. I mean, I put out there some things about Black and white and about bias and about a whole lot of things. But you know what? I'm an old woman. So, what is that going to hurt for me? Right. But some of you might feel that you might put some things at risk. Right? Depending on who you are, where you work, who you're around, and things like that. So I understand it.
Well, I'd like to comment that maybe, possibly, also it's culturally. Culturally, a lot of us have been reared that what happens in the home or what happens close-knit in the family stays in the family. And so a lot of people aren't used to sharing information and putting it out on a public forum, a platform. I also want to say though, after having experienced Health Unlocked myself, and just, you guys know I'm a talker, but more than anything, also I'm a writer. I share what it is I think and I feel to the best of my knowledge. And I have been absolutely free to do so on that platform and speak openly and honestly and authentically about the things that I have experienced as a Black person, and ask others what they're experiencing as well. Because even during COVID, that was just another form of isolation, I feel like, plus, having a bleeding disorder and other health issues and just so much going on. It was just a great place to be on, where you could kind of release some of the things that was going on in your life and feel safe to do so. And also hear from other people and hear things that they were doing to get through. So Health Unlocked, it's a great place to share, to talk, and to learn.
That is so
I would-
true. And I do want to say a little bit, excuse me, Chris. This is solution focused. Remember, when we come on, we share the things that's going on across the country. We want to come to some resolution to help people across the country. What worked in California with the patient in California, and it might help somebody in Rhode Island or Cleveland or in the Carolinas to come. They might hear a common theme like, oh, I've ran into that issue. What did you do to solve it? And how did it come out for you? And how did your treatment staff treat you afterwards and things like that? Creating a checklist from the wisdom and the knowledge from your peers from across the country. That's a great thing. So Connie, you're so right. It's an awesome platform to be able to get that type of knowledge. Okay, Chris, I'm quiet now. Go ahead. I'm so sorry.
Not at all. You did the right thing. That was what we're trying to do. So, for example, I have I talked a little bit about myself as I have two legs that are permanently fused. So, talking about this discussions about being without knees and walking, and you can still walk and doing all the kind of things. Tell your story about yourself, in that way in the platform and the Health Unlock. It helps you, makes you really, like Miss Connie had said, frees you from being who you are to tell you whoever to help somebody else who's in that same situation.
And then one thing I was just gonna say is that regarding Health Unlocked, you don't have to really just jump into the fire immediately if you're not comfortable. Kathy is kind of like on the opposite end of the spectrum for me. She got out, shared anything, and I'm really much more of a private person. So it took me a while to kind of warm up to the platform. But once I did, I realized, it was a great place to not only, express yourself and to kind of develop a sense of community and meet all these other people, but also to come up with solutions. Like Kathy said, it's solution driven, so we can figure out problems within our community. So it's really a great platform, and I think you should at least give it a shot.
Marley, it's some awesome questions over there.
Yeah, you ready for the next one?
Thank you, Eric. And Eric, you are right. I jumped out there with both feet. That's just me. But thank you for acknowledging that different people with different ways of handling their information, it's safe for all. Yeah.
All right, next question. As many of you know, I'm very interested in all aspects of mental health. I'm speaking as the person in the chat. Can you provide direction as to how to understand more about common biases Black people experience when seeking mental health counseling?
I can address that as a social worker. Wow, there's a lot packed into that question. First of all, how to understand more about common biases for the Black experience. The panel, give her a couple of things. How do they connect to our experience? Eric had said, Black doctors know the Black experience, right? But we also know that other people know the Black experience as well. How did they connect to us? How did they hook into that experience? Not being African American, how would we be able to help her?
Well, I think just thinking about it from the standpoint of a retired occupational therapist, it's like when you get a new diagnosis as a clinician, something you haven't seen before, you research, you study, you learn about it, and then you go, and if you find someone with that diagnosis or condition, you ask them about it because they become the subject matter expert on it. So these are the type things that you're going to have to put yourself in that place where you can do that or feel comfortable to do that. And hopefully the other individuals will feel comfortable to talk with you. Also understanding that in some Black families, there may be a stigma associated with mental health, and asking why that is, and then truly listening to the response through deep listening.
Does anybody else want to comment before I speak again?
Sure, I could comment.
Awesome.
Sure. Yeah, sure, I could comment. I guess first, as a therapist myself, I think that one way is to speak about the differences that we have with our clients. So if you have a client who identifies as Black or African American, sometimes when you do an intake, it gives you an opportunity to say, okay, how do you identify? What is that like for you being in this room? I see that we have some differences. How do you feel about that? How has that impacted you in the past? Do you have a preference for a Black therapist? So you can kind of speak about these things with a client and use that to kind of open a conversation about their experience. Generally, there's been over pathologizing of African Americans by certain assessment measures in mental health because they weren't created and normed with African Americans in mind, and also other groups as well. So there is some of that bias that may be experienced, that a more severe diagnosis may be given to Black person based on these other methods of assessment or diagnosis. And so that may be something to think about if someone presents to you as a client. Another thing that you could do is talk with the other colleagues of African American colleagues and of other ethnicities as well to see their experience. So I can speak to that as a clinician, and also as somebody that goes to therapy myself. I've had Black therapists and also therapists that weren't Black, and some of them would talk about the differences that we had and what it was like for me coming in and so on and so forth. And that's just really helped. It helps to enhance the therapeutic relationship too, because we can speak about, it's not always the elephant in the room, but speak about differences and not be afraid to talk about those topics.
Wow, Mosey, thank you. I also want to add, and I'm going to use child welfare as an example here. It is documented that when children go into foster care, they're already plagued with behavioral problems and separation issues and things like that. And there was a study done that said African American children were sent to counseling less often than all other children, because it was assumed that that was just the way they behaved. That was just the way they were. And it was not connected to a possible mental health issue, possible isolation, possible failure, attachment disorders or anything like that. It was just the way that they were. And, sometimes we get some stereotypes that said, well, that's just the way that they are, right? So when you mention mental health, sometimes there's a hesitation in some of the African American communities, as well as others, not just ours, when it comes to mental health. There are some cultural things connected to seeking out mental health counseling. And, one of the things that Connie said was there's still that mistrust. If I walk into the room and, some African Americans say, well, I'd rather have a woman doctor, or a male doctor, a Black doctor, a white doctor. And there's so many variables. Like Deja said in one of her responses, she said the cause and effect is hard to pinpoint as to truly all the layers up under that. So I don't want to dwell too much on that, but it's very important. As well as I still have peers in my hospital. I'll tell them a story that is associated to my color, and they will say, no, I just don't believe that. I just don't believe that somebody treated you like that. And they are really serious because they have no they have nothing to connect that experience to other than my voice speaking it. Now, I don't have a problem with saying anything that happens to me, right? Somebody comes up and calls me the N-word, a little kid, a little 5-year-old kid, N-word. No, Kathy, I don't believe that. Okay, well, it's okay. I just made that story up, right? So that's another reason why we don't seek and connect sometimes. But if you just listen, and if you hear the stories and say, well, maybe that is possible, and what can I do about it? That would be really powerful for most brown people that you connect yourself to. That was a great question.
And what a perfect way to end the session, Kathy. Thank you so much to Kathy as our moderator and the rest of the panel, who, by the way, are also serving as the leadership committee for this entire platform and this, this online community that's being built. So just thank you all for joining, and we will catch you another time.
Thank you, everybody. It was awesome. And thank the panelists as well. And somebody asked, how do I get onto the platform? Is that in the chat? The
Yes.
link?
It has been posted several times, but maybe
Awesome.
Elvira, can you post that first message just one final time really quick
Thank
for
you.
anyone who still needs to get it? Anyway, thank you all so much for joining, and we hope you enjoy the rest of this 2021 Bleeding Disorders Conference.
Thank you, everybody. Have a great evening.
Take care.